Well, Bruce, healthcare is the hot topic, especially when it comes to rights of conscience. First, let's talk about the parts of the new healthcare law that are objectionable to Christians.
Right. In 2010, the Affordable Care Act was passed. It's also been known as Obamacare. As part of that law, the Secretary of Health and Human Services, or HHS, was charged with coming up with the types of services that would be included in employers' health plans under the topic of preventive services. Now, HHS worked carefully with people from the abortion industry to define preventive services, and what we've got now is the idea that preventing a pregnancy is the same thing as preventing a disease, and therefore employers need to include things such as contraceptives, including possible abortion-causing drugs, in their health care plans as part of these preventive services. Now, the employers, a lot of whom have religious conscience problems with that law, have sued the federal government because they're forced with only three choices. They can comply and violate their conscience, they can face huge fines that are imposed for not obeying the law, or they can go out of business. And that's the type of choice that in America really should be completely unacceptable. And this country was not founded on making those kinds of choices.
Let's go back to foundational. What are rights of conscience?
Rights of conscience basically flow from the First Amendment's religion clause. It's the guaranteed right to make moral judgments based for your own behavior and not be forced to compromise that behavior because of what somebody else believes in, i.e. the federal government in this case. In the healthcare context, what we're talking about is hospitals, government-owned hospitals that are forced doctors and nurses to perform abortions. In some states, we're also talking about pharmacists who are regulated by state government being forced to dispense abortion-causing drugs against their religious conscience. And they're told, well, you can either go out of business or you can, dispense these drugs that violate your conscience. The politicians in these states and the special interest groups behind these laws really don't care about accommodating the religious objections here. They're all about forcing these people out of business in order to further the agenda that we're currently forced in, which is you will obey the new reality, the new secular reality, at the expense of your own faith. And that's just the way it's going to be. That, in short, is tyranny.